The Ministry of Health has directed all health service agencies and teaching hospital facilities to allocate at least 10% of their internally generated funds towards facility maintenance and equipment replacement. While answering questions in Parliament, the Minister, Kwabena Mintah-Kando, said the directive is aimed at addressing the poor maintenance culture in health facilities and ensuring the delivery of quality healthcare services.
Equipment retooling program is underway to replace obsolete and non-functional equipment nationwide. Under this program, the dialysis machines initiative has been prioritized and is currently at the tendering stage to expand access to dialysis services and improve the management of renal conditions. Maintenance culture is also being strengthened. Health service agencies, including the Ghana Health Service and teaching hospitals facilities, have been directed to allocate not less than 10% of their internally generated funds towards maintenance and the replacement of equipment to reduce avoidable breakdowns and preserve functionality. In addition, urgent gaps in life-saving equipment are being addressed through targeted support to facilities with immediate needs. This includes the provision of equipment to facilities such as Asariso Hospital and the Tamale Teaching Hospitals, among others.